All right, let's go ahead and get started. The time is about 9 o'clock on the dot, and today is Tuesday, September 10th. And if you are in this session, then you are here as a regular retiree under 67 years old. If you have attended this session before, thank you for coming back. I'm sure that there are more people that will be logging in as we complete this session, but for those of you who are on, just know that this session is being recorded, so it will be available for you to review at a later time. My name is Asia Simpson. I'm the Wellness and Benefits Consultant for your school district, for your retirees, for your MTA office, for all of your active employees. And if you have been here anytime within the last 5 or 6 years, you have seen my smiling face doing this presentation, either virtually or on site. Just a couple of quick housekeeping items for today. I am going to go through all of the content that I want to share with you first, and we will save all of the questions for the end. And trust me, there will be time to answer your questions. I am here on the line. As you can see, David Navarre from the MTA office is on the line. We also have Laura Simmons from the Benefits Department who is on the line. So your questions will get answered. Please make sure that until we get to the question and answer part, that you at least keep your microphone on mute. That way, if there's any background noise, a dog barking, paper shuffling, it won't interrupt any of the content that I'm going to be sharing. So make sure that you are on mute. Okay, so you do that by selecting the little microphone in the bottom left corner and making sure there is a red X through it. So make sure you take a look now. I do hear a few people in the background. Also, in addition to this session being recorded, the presentation deck will actually be available for you to download. And I'm also going to do something a little different than what I typically do. Before I take the question and answer, I'm going to show you how to get to the benefit site so that you can look at where the retiree letter will be once it gets posted. And also, I'm going to show you where the MTA retiree website is, where you can actually go to look for the recording. So I'll show you how to do that after I present everything and before the Q&A. All right, so now that I have jabbered on all of the housekeeping items, I am going to go ahead and get us started. So I'm going to start with sharing my screen here. And David, do you mind giving me a thumbs up if you can see my screen? Okay, perfect. All right, so let's make this big so everyone can see this. So as I mentioned before, this is the Retiree Health Insurance Town Hall, and this is for regular and under 67. We will be doing one for those who are 67 and older, and that one will begin shortly after this one at 11 a.m. So if you're a person who likes to watch both and log in for both, you're welcome to do that. If you're not able to watch the second session from a schedule standpoint, you can watch it later. All right, so what are we going to cover today? So some of you know the drill on this, and so we will be covering what the reimbursement amounts are for the 2025 year. Just know that all the information we share today is effective January 1. So whatever you have in terms of plans, whatever you're paying and whatever you're receiving in terms of reimbursement amounts, that is going to maintain all the way until December 31st of this year. So everything we're talking about is going to be effective for next year. So we're going to be talking about, keeping with that, we'll be talking about the 2025 plan updates for CalPERS. We'll look at the CalPERS Medicare health options. We'll take a look at dental and vision rates. I know some of you have been waiting on that information. And then I want to make sure you all know who to contact for resources. So we will look at some quick frequently asked questions that I do get asked a lot that I just want to make sure all of you know. We'll review the resources, take a look at the benefits page, the MTA page, and then any questions that you have, you can ask those. I will say, if you have any questions that are like health related to like your situation where you're talking about your health, let's just talk you and I offline if that's the case, because we don't want to share your protected health information on this recording, okay? All right, so we've already talked about who this session focuses on. Let's talk first and get this out of the way, the reimbursement amounts. So for regular retiree up to 67, your medical insurance reimbursement will be $1,710 beginning in 2025. What that means is, for those of you who are new, is that whatever health plan you choose, whatever the premium is that's attached to that health plan, the district will pay up to or reimburse you for that amount up to $1,710 beginning January 1. It may be something different now, it's around 16 something now for this year, but beginning January 1, they will reimburse up to $1,710. I want to be clear, if you choose a plan that is more expensive than this, than those 1710, or you choose a plan where it is you and a spouse and it exceeds that amount, you will be responsible for the difference that is beyond the $1,710. And generally what happens is you are billed for your premium, the district reimburses you through, usually it comes through your STRS account, but it's $1,710. So you would just be responsible for the difference. If you choose a plan that is less than that, you will not be getting a refund or a credit or anything. That you just are covered for whatever the cost of your premium is if it is less than the $1,710. We'll be talking about this in the next session, but for trust fund retirees, if you happen to be in this session and you're over 67, the medical insurance for you is reimbursed up to $500 in 2025. And David, correct me if anything is changed with that, just let me know, but I think it's still, the trust fund is still, okay, great. Now, if you are over 67 and you are not part of the trust, because I recognize some people may or may not be, typically we've got mostly people on here who are part of the trust, but the district stops doing their reimbursement at the age of 67. So beyond that, the district would no longer be doing any type of reimbursement. Now, what happens is if you are a part of the trust, then that's when the trust kicks in. So good kudos to you if you've been paying into it, because you have, your reimbursements from the district up to 67. And then once you hit 67, then you've got the trust that will kick in. So that's a good thing. We'll talk a little bit about, it's 500 versus 1,710. I want to mention to you, when you hit 65 and you get Medicare related, Medicare approved health plans, cost for health insurance is a lot lower. So that's one of the reasons why you see these drastic differences in reimbursement amounts. So it's good that you work for a school district that accounts for those things. And tries to make sure that there are options to help cover you. So active members, if you are on this call and you're not yet retired yet, but you're about to move into retirement, just know that active members will pay $300 per month, 2024, 2025 year, and retirees will pay $300 per month up to when they retire. 10 months of the year until you receive your benefit at 67. Okay, so you'll pay into this until it's time for you to receive your benefit. Okay, David, correct me if anything's different on that. But no dues are taken in August and September.
It's going to be $350 this year.
Oh, $350. Okay, all right.
Going up $50 next year, and then another $50. I'm sorry, $50 the next year, so for a total of $400.
Oh, so eventually. Okay. So I will correct that. David, can you repeat that one more time just to make sure the retirees don't understand that?
You know what? I think it is actually correct. Not that I'm looking at it. It's $350.
Last year was $250. This year's $300. Yeah. Okay. So it is. So this is correct.
Yes. Sorry.
Okay. All right. So what you see here is correct. It'll be $300 per month for the dues. But to his point, I'm glad he mentioned that. When you're attending these sessions, what you're going to see is that each year the dues will go up by $50. So that's really what the gist of it is. Okay. Now, Obviously that doesn't, now once you, let me just go back one. Now, once you hit 67, though, when you hit 67, then you stop paying dues and that's when your trust kicks in. So I just want to make sure you're clear on that, okay? So I just kind of said that. Once the retiree reaches age 67, the district stops reimbursing the retiree premium contribution, and then the trust kicks in. Now, once you retire, you all probably know this, but unless you're brand new and you're just approaching retirement, this may be new to you. But retirees may purchase dental, vision, and life and long-term care through the district. So one thing I haven't mentioned in the past, but I do want to say this now because I do get questions on it, is that yes, you can certainly purchase your dental, vision, and life and long-term care through the district. Those are portable. We'll talk about the terms around that. What you will see, and I do get questions about, is there are health plans through CalPERS that do have dental attached to it, dental and vision. Before you automatically go with those plans, I would highly encourage you to take a look at them and see if they are better than the coverage that you receive through any dental, vision, and life that you would purchase through the district. Oftentimes they can be very, very different. It can sometimes seem pretty appealing, but then when you get the plan and you're utilizing it, you realize that they fall short of meeting your needs. And the important thing for you to remember about this is that you don't want to drop your dental and vision through the district, because once you drop it, you can't get it back. There's no start and stop. So district minimum contribution, for many of you, this may not even matter, but if you were a person who retired prior to September 13th of 2009, then there is a employer contribution amount that the district will pay on your behalf. And that amount is for the 2025 year, for those who this applies to, is 126.40. This is not anything that is credited. This is not anything that you would really even see if this is applies to you. It's an amount that would be paid on your behalf directly to CalPERS, and this would not be reimbursed back to your account for any credits or anything. So this is more of notifying those who this applies to. Again, this only for those who retired prior to September 13th, 2009. And if that is you, you likely understand and know what this is about. If not, we can always talk offline about it. All right, CalPERS retirement planning. Since we are really talking about, and I alluded to in the very first slide, that as you get into Medicare age and you are eligible for Medicare plans, then things do change. And I would suggest to you, if you are someone who are not yet 65 years old, you are retired, some of this information is going to be helpful for you. So what I would suggest to you, just as a few tips, is number one, we do a Medicare 101 workshop. We did one in May, but we are also doing another one in November. So we did a spring and now we're going to be doing a fall one. Attend that workshop. It will provide you with a whole host of good information. We'll also have a CalPERS Medicare specialist who will be there. They work for Kaiser, but they do provide very neutral information. So number one, attend that session. Number two, what I would remind you, just as some basics, is that at least 3 months before you turn 65, you want to sign up for Medicare Part A and B, not D. D is already embedded in your plan. Part D is for your prescription drugs, okay? So don't look at any of those mailers you get in the mail and sign up for any of that. If you do, you will lose your CalPERS plan. So you don't want to mess with that. But you want to sign up, contact Social Security Administration, sign up for Medicare Part A and B. And what will happen is they will typically send notification to CalPERS to let them know you did. But I'd just double check if I were you, because you keeping your CalPERS health plan is contingent on you signing up for Medicare if you are 65 and older. You have to do that, okay? I want to mention a couple things. If you are approaching 65, and those who are over 65, you can probably vouch for this. You are probably getting bombarded with a boatload of different mailers from Kaiser and Anthem and all these other weird health plans that you've not ever heard of before. You may be getting information from CalPERS, Social Security. you are probably being bombarded. And so the question a lot of people have is, okay, well, what's important? What's legit? What should I keep and what should not? So here's what I would say is rule of thumb. If you're already enrolled in a health plan, and like, let's just say you are in the Kaiser Permanente Medicare Advantage plan and you're getting things from Kaiser, unless it is directly from your plan, like something to let you know that you owe something, or it's an update to your summary of benefits, something like that, you can keep that. But if it's like a mailer where it says enroll in Kaiser today, that is a separate Kaiser plan that is not attached to CalPERS. So I would toss that, and anything you get from any other health plans that are not part of CalPERS. And you want to confirm that if you are looking at it and considering it, that it is in fact a plan, a part of CalPERS. You can keep any correspondence from CalPERS. You can keep any correspondence from Social Security Administration. In fact, you do want to. And you want to keep your correspondence from the Centers for Medicare and Medicaid Services. And make sure you review those carefully and respond appropriately. Don't just look at them and toss them to the side, because sometimes your response to one is contingent on, your eligibility for another. For example, you may get something from the Center for Medicaid and Medicare Services. If you do read it, make sure you understand it, respond to it, because if it is regarding eligibility, it could affect your ability to stay with your CalPERS plan. Okay. When in doubt, if you have any questions, you're always welcome to reach out to me. I'm happy to help you look at a notice or letter that you don't understand. Um, and I have this on here because when you download the resources, you'll be able to click here. But you can view the recording of the 2024 Medicare 101 workshop from the spring. And when you pull up this presentation, you'll be able to click from the presentation and it will allow you to view the document that has the recordings and all of that. So make sure you take a look at that, especially if you won't be able to attend the fall Medicare 101 workshop. And the fall Medicare 101 workshop I mentioned is November 7th at 4 p.m. So you will be able to, even if you miss the November one, it will be recorded as well. And so I know that a lot of times people are not very keen on doing things virtually, but one of the benefits of doing everything virtually is that if you're not able to log in or attend anything, you always have access to being able to view the information later, okay? So I just want to take a quick look, just for those of you who are pretty new. CalPERS retiree premiums, just so you know, they're in the process of shifting to a one rate for all areas of California. It's not quite there yet. So what that means is that the premiums are set based off of where you live. So if you have someone who has retired and you guys were talking and you say, oh, my rates went up by XYZ, and they say, oh, well, mine didn't go up, just know that a lot of that could be based off of where they live, especially if you have the same plan. Now, obviously, it's contingent on a lot of other things, what type of plan are you enrolled in, how many people are on your plan, a lot of those things. But one of those factors is based off of where you live. And if you've ever visited the CalPERS website and looked at the rates, then you'll see that they release the rates based off of region. So they've got some that are based off of your Northern California counties. They've got rates that are based off of the central area, and then they've got some that are based off of the Southern California area. And they also do have one that has a listing of rates for those who are out of state. Keep in mind, not all plans that are available can be used out of state, but some can. CalPERS, as I mentioned, is working towards a rating system that will be the same all across the state of California. And so we've already completed 1 year of the transition, so we've got 2 more years. So plan updates. Let's talk about the fun part that many of you have been waiting on. So the 2025 plan updates, all these updates that I'm referring to, these take effect January 1 of 2025, okay? First and biggest change for many people, and you've probably received letters, notifications, and whatnot. So I want to shed a little light, give a little bit more clarity. The PERS PPO plans, if you've been with PERS for a while, you know that for the past 3 decades, it has historically been administered by Anthem Blue Cross. But as of January 1st of 2025, Blue Shield of California will be the new plan administrator for the PERS PPOs. That is both the platinum and the gold. There are only two at this point. However, there will be no changes in whatever your copays, your coinsurance, your deductibles, all of that will remain the same. In addition to the pharmacy benefits will remain with Optum RX. So essentially, you should not have any disruption in your providers, in your pharmacy benefit. Now, the overlap of doctors that are in the Anthem network versus what's in the Blue Shield network, it's pretty close. However, should you find yourself in a situation where your provider, you're provided notification that your provider is not a part of the Blue Shield network, you want to make sure you immediately contact Blue Shield. They do have a third-party administrator that they've been working with to kind of help with that. So they may be able to provide, or they will be able to provide some resources to you in terms of making sure that you can find a provider that is within the Blue Shield network. Now, the goal, though, honestly speaking, is to keep you all with right where you are. So just to give context around the similarities in the network, there's about a 96, 97% similar coverage. So just know that the likelihood of your provider not being in the network is pretty slim, but if that is the case, you will be provided some help. And if you're not able to get any help, I'm happy to assist you with trying to find a doctor that is in your network. So my information will be in this presentation. My contact information will be in the presentation. The other thing that is new is United Healthcare Medicare Advantage Edge plan will not be offered in the 2025 plan year. So if you currently have that plan, that one will not be offered. For some of you who are not aware, there are two in the current year, in 2024 through December 31st of this year. There are two United Healthcare plans. One is the United Healthcare Medicare Advantage, and then they have one that is the one I have listed here, United Healthcare Medicare Advantage Edge. So they will be dropping one of them and there will just be the one, okay? The other thing is, this may not matter to any of you really because we don't have this plan down in Southern California, but some of you may be logging in from Northern California. But Western Health Advantage Edge MyCare Select will not be offered in the 2025 plan year. So those are two plans that will not be offered. That embedded in this presentation is the link here where you can view the Medicare and basic health plans for the 2025 plan year. Okay, so that information will be available. You will likely not see the updated information until right when open enrollment starts, which is next week. So dental and vision plan changes. There are no copay benefit or coinsurance changes. No changes really for the dental and vision. So you can rest assured you don't have to remember anything new for the dental and vision. That is going to remain the same. I just want to take a quick look because I mentioned about the plans that are available for Medicare for the new year and the changes that I mentioned. So right now, as it stands, these are the plan options that are available. Okay, you've got Kaiser Permanente. These are Medicare. The first ones titled in the orange header. These are all Medicare Advantage plans, which are essentially plans that have contracted with Medicare and they coordinate all the billing and all of that on behalf of Medicare. If you have a PERS supplement, a PERS platinum, or PERS gold plan, those are Medicare supplement plans where you have Medicare as your primary and then the supplement picks up anything that is left over as long as it is within the Medicare guidelines. And the PERS platinum plan and the gold are PPO supplement plans. The platinum plan is a good option for those who plan to reside outside of the state of California. It's usually a really good plan. Especially also, I've gotten questions too if people are traveling out of the country. There are some travel benefit options there. We can talk details about that offline if you do have questions. But in terms of the Medicare Advantage plans, I want to go back to that. The Kaiser Permanente HMO Medicare Advantage plans, they have the Senior Advantage plan, which most of you are pretty familiar with. That's the one they've had for eons. They do have an option with or without dental. Again, before you drop your district dental, I would advise you to check the benefit of the dental with that plan versus the district, because once you drop the district dental, you can't get it back. But they have two. They have the Senior Advantage, some regular Medicare Advantage, and then there is the Senior Advantage Summit. The Summit, really the differences, and I'll take a look at the differences here in another slide. I'll show you them side by side. But it really depends on the difference between what you're paying throughout the year for regular doctor's visits and whatnot. That's how they really are different, how they differ. And we'll look at that shortly. As I mentioned before, United Healthcare, Medicare Advantage, PPO plan, that one will be offered next year, but the Edge one is going to be gone. There is an Anthem Blue Cross Medicare Preferred PPO plan that is an option, and there is a Blue Shield Medicare Advantage PPO plan. Okay, so these are the options. I want to say something that I just said before, but I want to reiterate. All CalPERS Medicare plans have a prescription drug benefit that is included in your health plan. You do not need to, in fact, do not apply for any type of Part D coverage. If you do, you could lose your Medicare plan through CalPERS. So that's important for you to know. Do not sign up for it. And as I mentioned just a moment ago, with the changes to the plan administrator for the PPOs, the OptumRx will remain for the time being the plan administrator for the benefits, prescription drug benefits for the PERS plan. So that's not going to change. So the goal with the change with the plan administrator for the PERS PPO plans is to create as little disruption while they're doing this transition as possible. So hopefully you won't experience any issues. And if you do, please let me know. I'm here to see what I can do to possibly help. Okay, I mentioned this before, but I will say this. Kaiser if you do not have a PERS PPO plan and you are not yet in a Medicare related plan, or if you have the Blue Shield one, I want you to know Kaiser and Blue Shield, they administer their own prescription drug benefits as they have done in the past. So just know, when it comes to getting your scripts filled, if it's Kaiser, you know how Kaiser works. Everything's all in-house. And Blue Shield usually administers their own. They usually they prefer a lot of people to go to CVS Caremark, but you're not bound to that. Again, for the PPOs though, that's not going to change for the 2025 year. You're still going to keep OptumRx until further notice. So just know that. So I promised that I would talk about the difference between the two Kaiser plans. And this is also, I believe, if I'm not mistaken, I do remember seeing this on the MTA retiree website as well. So this actually just shows really the differences between the two Kaiser plans. The Senior Advantage plan is the old school one that everybody remembers. And then the new one that came out a couple years ago is the Senior Advantage plan. So you have two options. So the annual out of pocket is the same, but where it differs is, like all of those things, little things that you get throughout the year, this is with the Senior Advantage Summit, you pay basically nothing unless you're going to the ER, you're getting your prescription drugs. So it's zero. So just know that when you're looking at these two plans, if you say, why is the Senior Advantage Summit plan more expensive for a premium than the Senior Advantage? Well, it's more expensive because throughout the year, you don't have to pay for doctor's visits, allergy injections, lab x-rays, all of that. It's all zero cost. So if you choose between the two and your goal is, okay, I want the cheapest premium to pay for the Kaiser plan, then you're going to want to do the Senior Advantage. But if you want a plan where you don't have to pay anything when you go see the doctors or get your allergy injections or lab x-rays, then the Summit may be a better option for you. And again, this will be available in this presentation, and this comparison is also on the MTA retiree page as well. So quick, important health enrollment reminders that I want to just kind of package this up very nicely as it pertains to the medical. So 2024, I mentioned this before, the 2024 CalPERS open enrollment begins next week, September 16th, and it goes through October 11th. This is the time frame for which you want to make your changes. You cannot make any changes this week. So if you're rushing, trying to figure everything out right now, you can figure it out, but you won't be able to do anything until at least September 16th. So September 16th through October 11th is when you can make your open enrollment elections for your medical plans if you choose to make any changes. You may use your current plan with your current elections, your current tier, all of that. That will be, you'll be able to continue to use that all the way through December 31st. And if you don't make any plan changes, your current plan will reset beginning January 1. By reset, what I mean is any deductibles, any of that you may have built into your plan, whatever you've paid, all of that resets to zero beginning in January 1 of 2025. If you switch health plans, your new health plan will take effect January 1, 2025. You see the trend here. Everything we're talking about begins January 1. If you change your health plan, you'll receive your new ID cards from your new health plan. That will not come from CalPERS. I want to make a clear point is that be aware that a medical group ending its contract with a health plan does not create a qualifying event. And for those of you who know about qualifying events are life changes and they are listed on the CalPERS website. And that does sometimes allow you to make changes to your plan in the middle of the year, when otherwise, once you've made your changes for open enrollment, you have to keep them until the next open enrollment. But there are some situations where life changes, like a spouse passes away or something like that, or you have a new dependent you're adding to your plan. Those might be options for you in terms of life changes. However, if your provider decides that they are no longer going to be in practice anymore, that is not considered a qualifying event. You would simply have to choose a different provider. Okay. Carefully review. The other thing that I want to make sure that you know is that ID cards, I mentioned this before, are issued by the health plan, not by CalPERS. And if you need additional cards, make sure you contact your health plan. But you want to make sure you review your pay warrant to ensure that your health plan premium has been updated based off of your plan elections. And that's important because I do have some of you reach out to me and say, hey, I made this change a year ago and they never they never updated the premium. So these are things that are very important for you to make sure you're taking a look at, because that can be devastating for some people, especially, a huge change without having realized, if you have a set income, you want to make sure you're paying attention to that. And if your January warrant doesn't show your new premium, which again, January is when the new plan options are set to take effect. New premiums are set to take effect January 1. If you don't see it, you should see it in the subsequent pay periods. And if you don't see the correct deduction applied in your February warrant, then you need to contact CalPERS right away. So let's move into the dental PPO reminders. This is an old slide. It has, but it still has correct information. But I just want to remind everyone, one of the enhancements that was done to the MetLife Dental PPO for retirees was, as of January 1 of 2021, your fillings are now porcelain, and the calendar year maximum was increased from $1,750 to $2,500. So just a quick reminder on that. But in terms of rates, no changes for your vision. I want to make sure you know that this is what it is currently. This is what it will be next year. So no changes. Okay. The debits and credits and all of that stuff for your dental and vision should only be debits. They're paid through the Coast is the administrator for the deductions. Okay. However, the benefit plan itself is VSP Vision. You probably know that. This is all hyperlinked, so if you want to look at the VSP Vision website, you are welcome to do that. No changes for the premiums for dental as well, for the dental PPO. This is what it is currently. This is what it will be for the new year. Okay. MetLife is who does the dental benefits. And for those of you who have the dental HMO, that no changes as well. Quick little point on the dental HMO. The dental HMO works very much like a medical HMO. You have to select your dentist before you can actually go see your dentist. And you have to have your regular primary dental provider before you can go and see any type of specialty dental providers. Like if you have to have an oral surgeon or whatever, it has to be routed through your primary dentist. Okay, so they're kind of like the gatekeeper, they direct all your needs, very similar to an HMO. Okay, because it's a bit more rigid, then that's why the rates are a bit cheaper. The dental PPO, you can pretty much see whoever, whichever provider you would like to. So just a quick tidbit on that. Special note on dental and vision payments. Payments for dental and vision premiums must be deducted from your account through which is a banking institution of your choice. I mentioned that it is of your choice. If you have a banking institution on file that you gave to your benefits department when you retired, and then you changed and did not notify the benefits department, then there is no way that they're going to know that unless there's a kickback from your old banking institution. And they are not privy to just make the changes without your permission. So if you have any changes to your banking information, you must notify. It says Coast here, that was Coast in the past. Actually, what we want to do is have you notify the benefits department, actually. Notify the benefits department of any banking changes. And because failure to do so could result in a lapse in payment. And when you have missed your dental premiums and vision premiums, you could end up losing your dental plan. As I mentioned before, there's no stop and start. So, you can't decide, oh, this month I'll have dental. Well, next month I won't, but I'll get it back the following month. It doesn't work like that. So you have to maintain continuous enrollment. So let's do a few frequently asked questions just to kind of make sure you have clarity. So generally, when are deductions typically withdrawn each month for dental and vision? In general, ideally, those deductions will occur between the 5th and the 15th of each month. Okay. And if there's an error in your deduction amount for your dental and vision, I would first contact the benefits department just to confirm the plan that you're on and the amount that should have been billed, and then you can contact Coast to correct the billing amount. Okay. And because you don't want to just contact them, and because they may not have the information that you believe that you set up in terms of, oh, I did single, or I did two-party, or I did family. You want to confirm that with the benefits department first. Benefits department. So there's quite a bit your benefits department still does for you in terms of dental and vision. So who do I need to contact if I need to change my bank? I mentioned that you want to contact your benefits department. Usually if a lot of you may be calling them, but you want to let them know that you're requesting for your account information to be updated for your banking. How do I find out how much my dental and vision premiums are? So it says that each year a letter is sent out to retirees, but I'm actually going to show you the letter is not mailed out anymore. It will be posted on the benefits department webpage. And when we finish this, I'm actually going to show you where that is. But I did include in this presentation the link, so you can click directly from this presentation, the link here, and it'll take you to the benefits webpage. And that's where you'll be able to find your dental and vision premiums. It'll be on a letter. And in that letter, it not only has the dental and vision premiums, but it also has the retiree reimbursement rates for the upcoming year. So who do I need to contact for changes in enrollment? For changes in medical plan enrollment, CalPERS. Benefits department can't do anything for you. Okay, it's CalPERS. But for dental and vision plan enrollment, you can contact the business benefits department if you have a dental and vision plan change through, or dental and vision plan through the district. Then you want to contact the benefits department. Okay. When will I get information on medical, dental, and vision? Well, we talked about dental and vision. The medical rates, each fall a letter is posted on like what the reimbursement rates are for the retirees up to the age of 67. That's posted on the benefits department page. Here's the link. But if you are asking or thinking, okay, well, what about that grid that tells me, if I'm over the age of 65, what are my rates going to be? And generally that rate grid is posted by the MTA department on their page. And I'll show you where that will be once that gets posted, okay? All right, just a quick recap. The MUSD Benefits Department will provide you with premium dental information for the dental and vision. And then information can be found on the MTA retiree page on that rate grid for those who are, they usually do two documents. One is under 67 and the other document is for those who are over 67. But please note both documents are for people who are 65 and older because, again, if you remember way back in the beginning, the reimbursements for the district stop at the age of 67. Okay. They handle changes in enrollment for dental and vision, and they have access to your dental and vision benefit information. So if you're trying to figure out, okay, did I pick two-party or family or what did I pick? You can contact the benefits department. Coast doesn't have access necessarily to your dental and vision benefit information. So what I mean by that is you wouldn't want to call Coast and start asking them, which benefits are, how much is my calendar year max for my dental? Those aren't questions that I would pose to Coast. Those are not questions that they would be really able to answer. You can ask me those types of questions or benefits department and I can help you. They can help you, but not Coast. They actually do really just control, not really control, but they are in charge of the debits in terms of debiting your dental and vision premiums, okay? And they can provide you with information around what the most recent amount that was debited and what's set to be debited. They can provide that to you. Some contacts. So the other question always becomes, okay, well, who do I contact for what and where do I get the information? Please make sure you save this presentation so that you have it. It will serve as a good resource source for you. So what we have here is Jonette Tucker. Many of you know her. I have the telephone number listed for her. There is some backup support, Courtney Bulls, and I have her email address here. We've also got the link for the MTA retiree website. And in your benefits department, we've got Laura Simmons and Vivian Lamelli. And then if you have long-term care benefits, I've had a few of you actually reach out to me for his contact information. So I thought I would make sure it's here. It's Harris Kivitz. Have his email and his phone number. You can call him directly. I have spoken with him recently. So this is a current telephone number. And then for myself, my email and telephone number, many of you already have both and have reached out to me. So this information will be accessible to you in the downloadable resources. Medical, make sure that just a quick reminder, all aspects of open enrollment for medical need to go through CalPERS. That includes policy selection, eligibility, if you want to add or delete dependents, all that needs to go through CalPERS. So you will want to contact CalPERS. I have the telephone number and the website here for you to review that, should you have any questions for them. So before we go into questions, though, I do want to show you where the retiree letter and where the MTA retiree webpage is. And so I'm going to just share here, kind of have it up already. I'm going to share with you my internet screen. So hopefully those of you can see it. So this is the MTA Teachers, Montebello Teachers Association retiree website. I'm not sure how often you guys go on here, but they do post the information, usually pretty current. Now, you won't see this information on here now yet for the recording because we're still in the process of doing the presentation. So none of that information is on there right now. But this was the previous year's information here. They have the benefit rates. This is, I think, what a lot of you generally ask me for, which is that rate grid. And so I want to remind you that this is where they generally will post this, and they do it. They're pretty regular with getting this information on here. Usually, this doesn't probably won't go out and be posted until what, maybe next week or so, into this week. I'm not sure, but this is the grid that you guys are usually asking me for, and I usually will direct you to this website, or I usually will direct you to Alonzo Ibanez. But just so you can see, I wonder if if you'll be able to see.
AJ, I'm sorry to interrupt. Can you try refreshing the page?
Oh, refreshing, is it not showing?
Yeah, go back one page and then refresh it. Yeah, because the new rate should be up there.
Oh, perfect. Sorry, so sorry. Okay, so thank you, Alonso. It is up. I didn't think you were actually going to have it up this soon, since open enrollment doesn't officially start until next year. Not next year, next week. But thank you for letting me know. So here is the one that many of you usually ask me about, and this is for those who are. Oh, let's see here. Let me do a little refresh again. Well, in the meantime, in between time, let me just let you know that this is where you would typically select. So if you click on it and you're on this session and you're under the age of 67, what you'll click on, what will show, I'm not sure if it's just because didn't have it refreshed, but this is the old one, but the new one will be there available. But this is really what it looks like. I'll make this just a bit bigger just so you guys can see. The only reason I say this is because I get questions on how this is going to work. So if you're under 67, that means you're still getting reimbursements from the district. And this lovely sheet, I really am grateful for MTA putting together, because it does show all the different scenarios that many retirees have. And it shows what the rates are. This usually feeds information from the CalPERS rates, and then how much you'll be reimbursed. So what's in green, if you see a green amount, that's what's being reimbursed. But if you see certain scenarios where there is a amount in red, that is the amount that you would be paying out of pocket. And note that all of this is with regards to each of the different scenarios. So take some time to look through it. We're not going to spend going through each and every single plan or anything like that. We could do that offline, but make sure you're selecting the region for yourself and taking a look at what your particular scenario might be. So are you a retiree with Medicare? Are you a retiree without Medicare? Are you a retiree with one dependent and only one of you have Medicare? All of these scenarios are here really to be able to customize and help you understand what's going to be taken out of your account. And so again, if you go to the montebelloteachers.org website, you can actually select on the retirees. This is where we are right now on the far right, and this will bring you to all of the information on here. Okay. So the other thing I want to show you all is the benefits webpage. And actually, I'm going to just kind of go back out so it's a little bit. So this is the montebello.k12.ca.us website. This is the main website that you'll probably see. But if you click on one of the links in my presentation, it's going to bring you directly to the benefits webpage. And this is where the 2025 letter will be. Right now, we've got the 2024 letter. But the 2025 will be posted soon. We just had access to the rates, so just please give a little bit of time for this information to be updated. But this is where the letter is. If you can download it, you can click the download button. You can save it. You can print it, or you can click it and just view it from here. And so again, this information is viewable on the benefits webpage. So this is the current year's information. So this is effective right now through December 31st. The new one will be posted within the next week or so by the benefits department. But I did want to show you where to get that information because that is very important. The other thing that I would also encourage you to make sure that you take a look at is just making sure that you take a look at what your resources are on here. And I check out the website from time to time. Sometimes there is information, there's updated information in here that might be applicable to you if you're not yet retired and you're in this session because you are about to retire and you wanted to just participate, there is some information in here if you're still active that might be applicable to you, like the HMO versus PPO workshop. That's another one. So, all right. With that being said, I know that I have talked everyone's ear off. And so what I would like to do at this point is, before I stop recording and go into Q&A, is I wanted to find out, Laura, David, Alonzo, were there any points that you guys wanted to make before we start taking questions and answers? Okay. All right.